Thank you very much. The title of the song was I Love You, Baby. And that fits well with what I'm going to talk about, where the excitement is gone, the mother has the baby in her hands and goes into depression because she doesn't know what to do with all the crying. So it's quite an interesting aspect. And I think this is quite an appropriate title. It's a neglected area. They are neglected by the husband who doesn't know what to do and can't breastfeed. The mother-in-law is giving instructions, so it's a nightmare. And you got a baby to look after. So it's quite interesting. If you look at postnatal care, we need to look at the care of the mother after delivery, and this involves a postpartum examination, medical care, proper follow-up, particularly if there's been a surgical intervention, health education. We need to remember that even though they are breastfeeding 6 months or 1 year, accidents happen and they do ovulate, even if they are fully breastfeeding after 3 to 4 months. And the next thing they say, oops, I felt something moving in my stomach, and they are pregnant again. So family planning is important. Child spacing is very important. 2 years would be ideal, but in older women, many of them would get pregnant in the 40s within a year. Nutrition is very important. And the last part, which I think is neglected, is psychological and social support. So this is a checklist that I found for postpartum counseling from the Association of Reproductive Health Professionals. In the physical examination, you're supposed to actually look at the nutrition of the mother because of the requirements, the caloric requirements. You look at the weight loss, the supplements like calcium, iron, prenatal vitamins, DHA, omega-3 fatty acids, and so on, and a whole lot of other things. If the patient is anemic, we need to look at the iron, because many of them may have had postpartum hemorrhage, and you know that the estimate of bleeding is really very poor. Just visual estimation is not good. So many of them actually are anemic. And you know that that's one of the biggest reasons why they get postnatal depression. It's actually low iron. Even if the hemoglobin is 12, which by international definition is normal, the ferritin tends to be low, but they are foggy in the head, just like Christina said, they have the fog brain. Constipation is another problem. Fluid consumption, that can be cultural, right? In the Malay community, they actually prevent them from drinking water. They don't drink too much water because they get leg swelling. The leg swelling is actually part of the physiological process of releasing the extra fluid. But they do this, and because you restrict fluid, your breast milk production gets affected. And then you have a crying baby, and the whole thing goes into a vicious cycle. So for breastfeeding mothers, there should be support and encouragement. You should have support groups, which we lack in our country. In Western countries, they're well developed. Additional caloric requirements, and careful about alcohol and caffeine consumption. Not really the mother will be jittery, the baby can become jittery. And those who have had a normal delivery, we don't forget about the pelvic floor exercises, because that is important for incontinence and so on. So if you look at a complete care, this is actually a checklist. And these are good because you can tick them off, and whoever is coming for this can actually provide this kind of care. So I'll go through some of these points of the benefits of breastfeeding and WHO recommendations, some of the factors of breast milk composition and the nutritional needs, and focus during lactation, healthy reading, and about functional food as well. So if you look at breast milk, of course, nobody will argue that it is the best nutrition a mother can give for the baby. But also remember what I said yesterday, that the mother's eating habits and her diet actually have triggered the taste buds of the baby in the womb. So some of them who eat this kind of spicy food and all. Now you wonder why the baby likes that kind of thing and actually doesn't like certain kinds of milk. And they like breast milk or don't like breast milk but like formula milk. So all these things, you're confusing the baby when you mix everything up. And the taste is different. Okay, so breast milk is important. It's a good source of nutrition. And they must get enough nutrients from the mother for the baby. So if the mother's nutrition is impaired, whatever she can deliver to the baby is also impaired. Okay? So when you look at nutrition, breast milk is the ideal nutrition source for the baby. And it helps the mother following childbirth, makes the uterus contract well, and the organs, particularly in the pelvis, to go back to normal. It prevents hemorrhage because it clears all the clots and everything from the uterus and makes it go back to normal quickly. And there is bonding between mother and child that is extremely important. And it has also immune factors that help protect the infants from illness. So breast milk has prebiotics, has probiotics, which also help in this, plus a whole lot of other things. There are HMOs, human milk oligosaccharides, there's lactoferrin, there's all sorts of stuff, DHA, which are all immune stimulators as well, and IgA as well. So there are many things that they have. So breastfeeding promotes enhanced performance on cognitive development and ready acceptance of solid foods. So if you look at WHO recommendations, colostrum, which is the initial part of, is the perfect food and should be initiated. That's why they say skin to skin at birth. Delayed cord clamping, which is very important because it decreases the incidence of anemia by 6 months, is now universally followed in many places. And skin to skin as well, early breastfeeding, which also helps. And this skin to skin, because the baby comes out, is probably sometimes yanked out, and it comes into this environment and shouts and screams, so it needs to calm down. So when you put them on the abdomen, similar to the kangaroo technique that has been practiced in South America for many years, and they listen to the mother's heartbeat and all that, and then they are warm, and they feel happy, and they settle down. So I think that's important. An exclusive breastfeeding for at least 6 months with continued breastfeeding with complementary food can be taken up to 2 years and beyond. So when you look at breast milk composition, there is a lot of changes in breast milk. There's fore milk, there's hind milk. Within the feeding itself, the composition changes. Even cows, when you milk them at different times, the melatonin content in cow's milk in the evening is much higher than in the morning. Cows that are fed on organic grass are different from cows fed on non-organic grass. So there are so much of literature even in animals, and same with humans. The time of the day, the constituents vary. The cause of lactation, they vary. Between different races and populations, they vary. So the variability, that's why if you look at literature on breast milk composition, you find such a wide thing when you study vitamin D or what, at different times of the day, and how do you interpret the data? Unless you're doing 24 hours breastfeeding, then the baby will have none. It's like doing a 24-hour urine test, for example. You can't do that. You disadvantage the baby. It's also influenced by genetic and environmental factors, the gender of the baby as well. I don't even want to talk it because it's an entire lecture on placental genetics and transfer of nutrients. It's more in the baby, more in the male baby compared to the female, but the Zika virus transmission in a male baby is 3 times more than a female baby because the immune response by the placenta is poorer. So there are all these gender differences as well. Infective status, maternal lifestyle, including dietary habits. So it's influenced by mother's diet and the concentration of fatty acids, and we heard Christina talk a lot on DHA yesterday, and a lot of good data, especially on preterm labor, and also for brain development. DHA is important for the eye, as well for cognitive function, and fat and water-soluble vitamins like the A, C, B1, B2, B6, B12, and also the mineral content of the human milk is less. And the human mature milk contains about 70 grams per liter of lactose, 5 to 15 grams per liter of oligosaccharides, of which 10% are acidic oligosaccharides. And these are influenced by genetics and diets. These are the human milk oligosaccharides, which play a big role now in infant growth and immune status and so on. Adequate intake is important to prevent nutrient loss from the body. The calcium requirements are high, and up to 10% of spinal bone can be gone in mothers who exclusively breastfeed without supplementation. And that's all published data. It's 3% at about 3 months, goes up to 10%. But this can be reversed when they stop breastfeeding. So therefore, a healthy, balanced diet is very important. And this is what I was alluding to: 3 months, 3%, 6 months, 6%, 12 months, 10%. Okay, so you do get quite a significant loss. So when you are looking at dietary factors, you need water. Your fluid is very important. Energy, carbohydrate, protein, all the vitamins, you know, the B1, B6 as well, and B12, A, C, E, biotin, choline, and the trace elements as well. You got iodine, selenium, zinc, potassium, chromium, copper, and manganese. So these are all higher in lactation. So this will be interesting. So let's look at nutrition provision. The nutrition transfer in breast milk is a key factor in determining the increased nutrition needs during lactation. And if you look at the volume of milk, on average is about 780 mils for the baby per day initially. And this is also reflected in the average concentration within the milk. So you find that there's a gestation requirement in infants through 0 to 12 months of like thiamine and so on. And there are a lot of data on all this. And the reality, the volume of breast milk varies, and it can even go up to about nearly a liter per day. And the nutrient transfer may be higher for some nutrients compared to the others. Okay? So milk intake against months of postpartum, it peaks here and then slowly it plateaus there. So this group of vitamins are not stored. Therefore, intake is so important, right? So you have the A, D, E, K, which are fat-soluble, which are stored, while these are not stored. Calcium, we have already talked about, which the requirements are higher, otherwise they get osteoporosis. If the calcium intake is less than 500 milligrams per day, they'll be in trouble. Folate, zinc, copper, and iron are regulated, do not depend on diet, but optimum intake is important for the patient's own health. Okay. Then you have DHA, fatty acids, important for the baby. Thiamine as well, depends on maternal intake. And riboflavin deficiency rapidly results in low milk concentration of the vitamin. So I think these are crucial nutrients that we have to look at if we intend to produce something which is useful for these women. If you look at B6, the breast milk concentration are reflected by maternal intake, and maternal supplementation rapidly increases the amount in the milk. And B12, this is important in vegetarians and vegans, and they are very severely deficient, some of them, in B12, and that can lead to deficiency in the baby, and this one may give problems in the baby. And vitamin A, of course, the content is affected by the mother. Now, careful, because too high content of vitamin A can be toxic, but we rarely reach that level. So when you look at the energy required in lactation, it is determined by the amount of milk that's produced, the energy content of the milk, and the efficiency of the energy conversion from dietary energy to milk energy, which is about 80%. So this gives rise to another 500 kilocalories per day in the first 6 months. So I think, we have to take into account all this and the variability in genetics and race when we talk about the energy costs in lactation. So vitamin B is very important for energy generation, and they need an extra 500 kilocalories to support milk production, so the intake is important. DHA, needless to say, that's very important for neural tissue and myelination, and it's about approximately 15% of fatty acids in the human frontal cortex. And human brain, you know that myelination goes on right up to the late teens to around to 20 years, most aggressively, but the highest rate is the first 2 years, because the brain size increases by nearly 200 to 300% at that time. And the evidence indicates that DHA in red blood cells at 2 months is also correlated to verbal activity at 9 months. So that's why the average intake is recommended about 200 milligrams per day in the mother to prevent deletion. To prevent the mother from having low DHA and the baby from having low DHA. So maternal diet, high carbohydrate and low fat is associated with high medium chain triglycerides and lower DHA concentration. Therefore, we should look at the mother's diet for the variability of output of DHA and gestational length at birth. Of course, preterm milk has got higher PUFA production compared to full-term milk. And parity also, the lipid content increases with parity up to the 3rd delivery. So there are many factors, and smoking decreases milk lipids. So it's quite interesting. There are many variables. So even if you supplement the mother with a higher level of DHA, it might actually overcome some of this, particularly the mother is smoking on the quiet or the type of diet, because in our community with the 3 races, there are a lot of variations in what they're allowed to eat and not eat, right? So this may even affect the DHA. Calcium, we have talked about calcium. There are about 280 milligrams to 400 milligrams are lost in breast milk a day. And in nursing of twins is about 1,000 milligrams. So we have not even talked about multiple pregnancy, twins and triplets. It's a different thing together. And also our data, which has been published, has shown that our incidence of Malaysian women having calcium intake is quite poor. And vitamin D is also important. And this is our intake total daily is about this. And the median intake of calcium is only this. Okay, so this is deficient. I think we have gone into that. Again, anemia is another big problem in Malaysia. We have up to 40 to 50% of rural Malays who actually have anemia in pregnancy, and most of them are iron deficiency, but we have thalassemia as well, and we look at their ferritin level as well. So this is a longitudinal study by Arija et al., and they looked at this. So adequate iron is important, because if you look at iron deficiency, it rises in trimester, and after delivery is still very high. And this one actually can contribute to depression, postnatal depression. This is just a schematic diagram of a non-pregnant woman, and because of menses, the hemoglobin is lower. The requirements for the fetus and placenta is so high during pregnancy, and then lactation and menses again. So there's a huge demand for iron here for the fetal development, as well as for the baby and for the mother, for the physiological anemia that occurs in pregnancy. And the clinical consequences of low iron in the mother. It's a negative effect on many things as well. Mental performance, enzymatic activity, inability to tolerate heavy blood loss, immune and neurological function, thermoregulation, and fatigue as well. So again here, you look at the mother, placental insufficiency, cardiac failure, maternal morbidity and mortality, and consequences in postpartum, reduced milk production, shorter lactation periods, postpartum depression and emotional instability, and impaired physical function in a mother who needs to be active to look after the baby. So iron is very important, and it can lead to low birth weight, miscarriage, preterm labor, chronic placental insufficiency, and all sorts of other complications in the baby, especially when the anemia is severe. We use 7 gram per deciliter as our cutoff for severe anemia. Okay, I've gone through this yesterday, and I'm not going to go through this today. This is available if you wish. And if you look at the power of the human milk proteome, you look at the functions, they are for growth, for innate immunity, for adaptive immunity, for gut development, and the components are proteins, glycoproteins, enzyme proteases, and endogenous peptides. So and of course, the famous gut-brain axis here, which is all the microbiome and all the stuff that comes in, along with this. I think it's a nice summary slide, which actually tells you the needs of the baby. And of course, if you look at this, all comes from nutrients, human milk, macronutrients, micronutrients, protein, fat, carbohydrates, minerals, vitamins, lipids, and sugars. Bioactive proteins and bioactive peptides have become very important for intestinal development, immune system, neurodevelopment, and so on, infant metabolism and growth, and infant gastrointestinal tract for, again, absorption, enzymatic activity, defense against pathogens, cell proliferation, and immune function. So these sort of 2 slides can actually summarize what you need, and we need to tailor the nutrition to the individual mother, taking into effect the genetics and cultural part of it. The last few slides, I think you all have seen this, MFGM, which is what everyone is talking about. There's a lot of literature on this. We don't have literature for the pregnant mother. But you know you have bits and pieces from, like Fonterra has got new lipids, which is sphingolipids and phospholipids and gangliosides, and there has been work on gangliosides, and I've done some work on transfer of gangliosides from the mother to baby during C-section. It's a passive transfer of the GM3, GD3 gangliosides, and it's a passive transfer. So we don't know enough whether this would be a product, and I think we need to do research in the mother while we are already having data on the baby. So this is interesting. Complex molecule. I think you have all heard to death, and I thought this summarizes the whole thing here from maternal body composition, gestation length, lactation period, genetics, maternal diet, infant sex, infections. These are the components in MFGM, fatty acids, phospholipids, glycosphingolipids, proteins, and so on. And here you go into structural, intestinal, and microbiota. So this is sort of the current state where we are with MFGM. The other one I'd like to briefly mention is lactoferrin. Now, lactoferrin is becoming very important. It's now coming out in some of the milk formulas, and you find that it has got antimicrobial effects, as well as it's involved with iron metabolism. It can absorb iron and release it as an independent mechanism. It's a protein. It's involved with gut maturation, cell proliferation, developmental of beneficial microbacteria like lactobacillus and bifidobacteria, and immune modulation. So this is a glycoprotein in the whey component of the human milk. So this is the other product that I think a lot of work is coming out in the future. There are others that I would like to do, so I just want to finish off this. We have all seen this, and after staying in Sofitel, we don't follow this. You know, it's the reverse there. You're eating a lot of these, hopefully you eat that. And this is what a good diet should be. I think these all do. And water is very important, about 10 glasses, 2.5 liters. They need an extra 2 glasses per day. And I just wanted to, this is also important, prebiotics and probiotics. Again, we talked about the bifidogenic bacteria prebiotics. I think the commonest one that MJ uses is actually inulin, but there are FOS, fructose oligosaccharides, and glucose oligosaccharides, galactose oligosaccharides as well, which different companies use. But they all have the same effect. Inulin is common. In fact, those who don't want to take it, I tell them to eat figs. Dried figs actually are good. They actually they are prebiotic, and they help in constipation. Plus, when you give them probiotics in pregnancy, the constipation actually reduces. And is associated with cytokine immunomodulatory function production in breast milk as well. Okay, so these are some of the criteria of gut health. I think I don't have the time just go on about probiotics, where the pathways of nutrients, maternal composition, intestine, antibody production, mother to baby, and coming down, and through the genital tract when they have vaginal delivery. But it's different when they have a C-section. The bacteria are different. So that's one of the things people are doing, how to compensate for all this. So these are all some of the nice pictures that, see KL go taking a picture. So, and here, the window of opportunity for microbiota modulation from the gestation, in utero, birth, infancy, toddler, and childhood. So here we have the placenta here. And contrary to what Jeff said yesterday, there's a 2019 paper which has shown that the placental microbiome is not true. It's not true. It was actually an artifact. So there goes your microbiome here. Neonatal factors, mode of delivery, gestational age, and postnatal factors like feeding, breast location, family members, and so on, and weaning are important in the window of opportunity. And this, the gut-brain axis, just to tell you where the Peyer's patches and the immune system, as well as a lot of stuff like serotonin, 5-hydroxytryptamine, and all are produced in the gut by good bacteria, make you feel good. So this is the new high. If you want to get high, go high on bacteria. So that's the way it is. So with this, I'm going to stop here. Thank you very much for listening.
Thank you, Dr. Raman. Is there any question for Dr. Raman?
Any comments?
Any comments?
Curses? Swears?
Any violent reactions? I have a question.
Sure.
In a normal, uncomplicated pregnancy and postpartum period, what nutritional supplement would you continue to prescribe even after 2 months postpartum?
Usually the routine supplementation that is given, depending on the iron level and all those, the multivitamins, nutrition, all that, each country is different. They should continue to take that. But importantly, some of the nutrients like DHA and all that have to be taken into special account. I usually make them take probiotics as well. Continue this during the pregnancy. Basically, they got to eat a balanced diet, increase 500 calories, and certain nutrients like DHA, choline, and so on have to be taken extra for brain development and breastfeed.
Yeah. So it's 600 milligrams to as high as 1,000 milligrams probably of DHA.
But I don't think, because if you look at the variability of DHA that actually comes out depending on the genetics and factors, I think that even if you would give a higher level, the actual excretion may be just enough.
Any other questions? Comments? So, yes, sir.
Chinese has got this practice for this. Sorry, the Chinese there's a practice for this confinement after the delivery. Does it make a difference for women have gone through this confinement stage versus those other races who basically don't do it?
Yes. That is a project for a PhD thesis. Because if you look at, there are confinement centers and there are confinement ladies in our country. The confinement ladies are dying out, old-fashioned. They use a lot of ginger, they use alcohol, and they use all this dong quai and balsam and ginseng, which makes them bleed, some of which are actually in the WHO list of poisons. And because they use dome, which contains a lot of alcohol, the babies are sleepy. So actually, I think that, but in spite of that, the Chinese population is the highest in the world. So what it tells me is the humans are surviving. They're still bright and they're still good and still better than Trump. So then it's still okay. So I think there will definitely be, because there's restriction of fluid intake, they go to wear, in a tropical climate, they wear 3 layers of clothes and socks. And they sweat like hell. And they don't allow them to drink fluids. Breast milk production actually is affected. Many of them go to formula, actually to supplement feeding. So I think that it is largely inadequate in many areas, because if you study the nutrition value and the practices, it's actually quite dangerous. And I think the infant is doing well because of formula. And mothers bleed as well. And nobody looks after the anemia that they have. And some of these 3% of Chinese women in our population are thalassemia. They carry alpha thalassemia. So the hemoglobin is already 9 or 10. And they would have bled, say, 400 mils, 500 mils. They're in bad shape. So, but I think this will be a lovely area for a research study in a multiracial country looking at our practice. Same in the Philippines. The mother-in-law is the biggest person who determines all this. The husband has no say. And I've had a lot of fights with the mother-in-laws over their nutrition. So be it. Thank you very much.
Thank you.